Welcome back to another episode of the Nurse Aspect Besties, where we assess and evaluate. I'm your host, Nurse Becca, and today we have Nurse David with us.
Hey, how are you?
Clap, 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 clap. Welcome, David.
How you doing?
Good. How you feeling?
Good.
All right. Why'd you get into nursing?
So I got into nursing. So I'm gonna be honest, nursing wasn't my first option. I did pre-med.
Really?
I did pre-med. I followed the courses for like pre-med. I was on track. Med school was my goal, but things happened, things changed. So nursing wasn't even my second choice. I was gonna do PA school, and then I met I guess I would say my mentor. I met her basically by accident. I shadowed her like at Brooklyn Hospital. Yeah.
Okay.
Yeah. We'll edit that part.
No, not even. I wasn't even saying it because of that. I was saying it because like Brooklyn Hospital, I feel like I didn't know you was in the hood like that.
Yeah. So no, it was just by accident. I went there, met my, I would say, mentor. She was really great. Showed me around. At the time, I was determined I would do PA, and I really didn't look into nursing, just because like nursing, I feel like everyone else does it. At the PA, I would have a direct interaction with making a lot like a difference in people's lives directly, especially working like close to the doctor. But I met her by accident and saw her role, and then she convinced me to do nursing. I gave it a try, and I'm forever grateful that I did it. And she was a nurse practitioner, really good, caring. She always put her patients first, and then she gave me a first-hand experience of how, like, when I say I want to do patient care and like give the best to my patients, like she showed it to me, and I saw that, hey, this is the best route to go for it.
Well, I would say like nothing happens by accident, so
Yeah.
it didn't happen by accident. It was meant for you to happen. So that's good. So like, how'd you get started? Like, where did you start?
So basically, after I went to a school in the city, not really my first choice, but it happened to be there. And then at the time, I'm not gonna lie, I was very scared I would not get into nursing school because I was just like, I did hit it low. I had pre-med in mind, and I was like kind of scared. I was like, oh, now like is it like a negative stigma? See, like I was on a pre-med course and I'm switching. Would they want me? I was like, would the school think that, hey, I would like switch out again? But I applied, and for the most part, I think I got into all my schools, thank God. And I after schooling, I applied to a local hospital. I got there. I did research, and looking back, am I happy that I did research? Yes. But I would if I could do it again, I would tell myself, hey, bite the bullet and do ICU first.
Oh,
I feel like ICU does give a lot more options. Once you get that experience out of the way, you can do basically your cream of the crop. You have all the experience. You want to go to nurse anesthesia, you can do that. You want to do outpatient, you'll be like first pick. You want to do cath lab.
First pick for outpatient? You need ICU experience for outpatient?
For most of them, yes.
Oh, I didn't know that.
I know like certain hospitals, they're like certain programs, they were like, oh, we want ICU, or even like emergency department too, I would definitely say. But definitely like for like later on schooling, especially like down the road, if I were to do NP myself, I would feel like, hey, I would want that ICU experience because like I want to give the best to my patients. Like me not knowing or not having that ICU experience, I feel like I don't have a better grasp of like nursing and what is a critical care when when I need to downgrade a patient. So I feel like I am lacking of that knowledge basically.
What's stopping you from going into the ICU now?
So luckily, I've been a nurse for 6 years. I have yet to do a night shift, and I'm not gonna lie, I don't think I'll function as a night nurse.
As a day shifter, whatever.
To be honest, like night shift, I don't know if I'll be able to like fully function, but it's something I'm open to. It's just like I know like nights is something I'm trying to avoid. If I can get lucky and get into a day ICU, I would definitely prefer that. But
good luck.
I know it's tough. But yeah, so like, if I were to tell my younger self or any like new grads, and any new grads I see, I tell them like, ER, emergency room, do ICU, and I feel like they have more opportunities to explore. So that's why, if I could do ICU, I would do it. And I feel like it would just give like the provider, a better like scope, basically.
Okay. So you said you've been a nurse for 6 years. So during that time, were you just only in med surge, or what have you been doing?
So I was in med search, I would say for like 4 years, but I was in two different systems. And then I got lucky. I was offered an opportunity where I could do outpatient procedures. I was just doing more of a pain management, more like spinal stimulators as an outpatient, doing like RFAs, like radio frequency ablations. So that basically opened up a new horizon for me to the outpatient world. And I'm not gonna lie, I am doing it right now, and it is super comfy. But I do feel at times like I do miss the craziness of a hospital.
Okay. How did you like stumble across this opportunity?
So it was one of my close friends. He joined a new practice and he needed a nurse. So he asked me first. I said no because like I was already doing the hospital. I don't know if I could do like two different jobs, but he was like persistent. Saying like, hey, we'll work towards your schedule. And then so he got me on board, and I'm forever grateful because through that I got my current job in my outpatient gig, basically.
I think we would all want to know, is the pay better than the hospital? Like, is the pay
Um,
worth it?
so I would say it depends on the company, but I would say the pay is equal. Also, like we went through a very unique time during COVID.
Mm-hmm.
A lot of changes happened, all economically, and then like and for like jobs as well too. It was a very unique situation. So at the time, when I first started over there, I did get paid higher than the hospital.
Mm-hmm.
Right now, like also like now everyone's like adjusting towards like inflation. So I would say it's like on par with it, especially I hate to say this, outpatient. I do like vital signs. I do, I just room patients. It's pretty cushy. Like a 10 on my job is like a zero, like a one, a zero on the hospital.
That's crazy.
So I love it that I work only 4 days a week.
I was about to ask you, what's your schedule like?
Yes, I only work 4 days a week, 4 10s, and then I have like 3 days off. But I do still pick up in the hospital, so I don't lose my skill,
Mhm.
and also I have the opportunity to pick up overtime as well too. So I am.
Have you been doing it?
I have been doing it. Yes.
Oh, okay.
Yeah, I have been doing it. I do miss the hospital though. So I know like only bad thing I would say about the outpatient is that, it's like very very relaxed. Very
Okay.
relaxed. Some people, like my nature, I have a drive. I want to like see what's up. What's going on. Yeah, I feel like it'll be a great job for someone who's like towards the end of the career. Hey, they know what they're going.
Mm-hmm.
I know like my family, like they actually worked on like my old floor, and then towards like when their kids all like graduated college, they went to like outpatient, like school nursing, office jobs, NPs. Whereas like they can like it's like it's very like this toll on your body is so much like easier on you doing outpatient.
Okay. What do you miss about med surge? Like, since you say you miss it.
So the med surge is like, so I know every day. So in med surge, the only problem I would say I had with med surge is like, I don't know what I'm gonna get. Like I hate to say like, me and you, we used to like, pair up, hey, what team am I getting? We
Yeah.
would bounce off, each other's assignments,
Mhm.
like, and then there's gonna be that one hell assignment, and we, you try to avoid it, and then you do get stuck with it, you're not gonna be a sucker and be like, oh, I'm only gonna take it for 1 day. If you're doing 3 days in a row, some people just suck it up and do 3 days, but it's gonna be a long 3 days. So that's the only thing I dread about. But I do miss the craziness, like patients. I feel like patients are more appreciative, they're more appreciative outpatient, but in hospital, like they're more appreciative that hey, you like they're probably deep down by themselves, like all by themselves, you know, lonely, don't know what's going on, so like you just reassuring makes a big impact on their life. In outpatient, my patients are grateful, but I know they're gonna walk out the door,
Yeah.
regardless. Some patients they don't know, are they gonna be, upgraded to ICU? Are they going to leave in 2 days, 1 day? Will they get to enjoy their holidays with their family? So it's all a mystery. And then, you try to do your best. And I feel like when I put in the effort for like these patients in the hospital, it goes much longer than someone like, getting a refill at an outpatient gig.
I mean, I could absolutely agree with you. Like, there's definitely been times like working in med surg that you're like, things could change in a second. Like, you could have a 3-day, like, all right, beautiful team. Like, all right, David, like, all right, your team is going to be golden. Like, I got you, whatever. And I come back the next day, like, yo, where is Mr. whatever? And they're like, oh, yo, definitely is in the ICU now or whatever. Like, things can really change in a second. I think that, like, sometimes, like, I feel like people don't really see that in med surg. Like, people look at med surg like, like, it's just like, it's like the basic, but like, you do learn skills. You do learn how to do things. You learn how to see different things. You kind of learn how to like prevent things or whatever, intervene or whatever. And unfortunately, if it gets there where like they have to be upgraded to like a more acute care or whatever, like you see all that. And honestly, like you tend to see more, like you can see death a lot and med surg that you don't really expect to see, So like you're almost there like from the beginning to the end. Like it's such a wide range of things that you can see versus like, you're right, in outpatient, you're not. I feel like if something was to happen in outpatient, it would just be so bizarre because it's like you're not explaining that. Like, how many times have you ever had like a patient in outpatient that like had an allergic reaction to something? Like that's not common, but like in the hospital, like you're prepared for that. Like, so I get the craziness, whatever. Sometimes I miss the craziness of med surg too, but I miss it, but not. It's I'm still in the hospital, so like I don't miss it like that. What do you think is the best part of med surg?
Definitely my colleagues, I had a good team. Like everywhere I went to, like both systems, I had really good colleagues. I get to bounce off them. They, like nursing compared to like other fields, like doesn't matter if you're a new nurse, old nurse. We used to joke around, call like our senior nurses like the Jurassic nurses, the Jerry nurses. Regardless, regardless, So
I was so good with you.
we had a whole range. We had a very dynamic team. Always changing, but everyone knew their part and everyone was there for like one goal. Like one of my colleagues, he does like IT. He's like, he went on a business trip with a bunch of like older gentlemen. Like he couldn't really interact with them because like, what do they have? Like what experiences they can share. Like me, you, like let's just say a Code Brown. Like how many people, like Code Brown to chest compressions.
Yeah.
Like that's very unique. Like me, you, and like this 90-year-old grandma. Like. How we have something to bond upon. Like I can't say other fields have that.
Yeah.
And definitely hospital staff, is like props to them. What they do, is definitely like they don't get the recognition they do, but that camaraderie we had, it was very, very unique, and I do miss it. Like I said, it's just like I'm compared to like outpatient, like we're all outpatient, like, hey, we do have a team, like you said. It doesn't go 0 to 100, Like me and you can be talking right now, like in our break room, and next thing you know, you hear Code Blue, and next,
everybody's on.
We're running right there, you know?
It's definitely a different vibe, like working together as a nurse. What I will say, in terms of like name calling, a little story time. I remember when I was leaving our unit, like I made the announcement, like, okay, like, I'm going to a different unit. And so now here I am. It was like one of my last days working with you. I think it was definitely my last day working with you. I'm looking for my assignment and I'm looking at the board like, yo, because you were charged, whatever. And I'm looking, I'm like, where's my name? Like, yo, like maybe I came to work on the wrong day and you definitely changed my name to Judas. I'm like, yo.
No, definitely, like, you leaving was, like, me and you were, like, a good dynamic team,
Yeah, we definitely
And, yeah, for you, you told me, like, hey, you're leaving, definitely was like, oh, man, now just, like, now I'm, like, solo, so I was, like, definitely felt betrayed, so I had to, but I definitely enjoyed our time, so,
And you're not even there now, like, you're not even there now, so.
I mean, you left, so,
Okay, please, all right, well. yeah, I love that. Like you're doing something different. Do you do anything on the side aside from like picking up shifts or anything like that? Do you do anything on the side or no?
For me, I would say I want to see like what else is there for nursing, you know? I definitely want to see what else is there. So I go to like these random like events. I met like a couple of great individuals.
Random events.
So no, just like hey, like you know, like one of my friends, like you know, they do like they like doctors, they do like host events, whatever. And I'm like, hey, can I come, whatever. And through them, I met like a friend of like he was actually one of my high school friends. He opened up like an IV therapy like an IV therapy business, you know, and like he has like nurses go and do IV therapies, and you know they tell me like stories. Oh, you know, I met like French Montana, I met Lil Durk, and you know, and then you know, one of my wife's colleague, he was an ICU nurse. Now he does hospital nursing just for like insurance purposes. But he has his whole like establishment where he does IV therapy, and he's like, it was during COVID basically. He's like, oh, you know, I'm gonna do NP school, and he's like, I'm gonna do NP school, but guess what? I'm still back chained to the hospital. He wanted that freedom to do, you know, freedom to like make his own schedule and all that. So he opened up his, and then he just ran across IV therapy basically, you know, just like after parties, big celebs, weddings, just go and give IV hydration to these people. And now he's like a thriving business, you know? And for me, it's just like, hey, you know, who doesn't want that freedom, you know?
Yeah.
Who doesn't want that freedom? Like, you know, I'm hoping that one day your podcast becomes famous that, you know,
Hello, you better
you
speak
know,
into
like,
life. Okay, okay. Speaking into life.
you know, you don't need to even, you know, like be in the hospital, you know, like everyone wants a sidekick. We all saw it like during COVID, you know, Nurse John became famous, you know, so many nurses, they switched up to like social media, had their own channels, doing their own thing, you know, because like, listen, nursing is great, but you know, it's not for everyone, you know, like not a lot of people can take that toll on their body that, you know, like they're not strong mentally to do it. So, you know, there are other branches, and, you know, I'm not saying like, you know, I feel like I may have the ability to do it, but, you know, it just takes like, one turn, you know, one slip of a patient, you know, and then you're hurt yourself and now you can't do it, you know? So I do always venture out and see like, hey, you know, what's out there. And for me, like definitely like IV therapy was definitely like one of them that came to mind, you know, just like, hey, make your own schedule, you put in IVs, you know, make your patients feel better, you know. So that's like one of the side gigs I've been looking into. Informatics was definitely like, you know, something I was looking into myself too.
Really?
Informatics. Yeah, I did get my master's in it.
Come on, degrees. You better run down the degrees now.
I did get my master's in it. I did it at a local university. I was really appreciative, especially on the EMR system. I am kind of hesitant to start it up. Only thing is like, hey, in the future, if I do need to move, how fluid is my job? One of the main reasons I got into nursing was, hey, if I want to move tomorrow with my family to Texas, I can get a job easily. I can't say that for other careers, you know?
Yeah.
Even with these remote jobs, I don't, you know, no one feels like, you know, hey, he's going to be there forever, you know?
Yeah.
Where it's like, oh, I know two of my friends who are ITs, they're like, oh, you know, since the beginning of 2010, yeah, we went fully remote, whatever. Both of them got laid off, you know? So it's, you know, for me, like, I want a job, especially in the economy we are right now, just to be like, hey, I have a solid income. And informatics at the moment, like, I don't feel, especially with all this AI coming up, you know, definitely got me, you know, like biting my nails and like,
But maybe there's something in it where you can come up with a nursing AI informatics kind of deal. That way you can pick up, you can forget Texas, you could be in Dubai, like, and running it. But like, you know, I feel like nursing is just so wide, it's so open, and the fact that you have different backgrounds and different things, I feel like, and you are a smart guy, like I feel like you can, you know, come up with something that will make it work. I feel like people come up with different things in nursing all the time, and like it could be literally be like the simplest thing, you know, to make our lives easier.
So the thing is, actually, there's already like you mentioned, there is already like an AI there, especially for doctors, where they help them with their practices. You know, I think they found there was like this new AI system that can, so a typical stroke, maybe they can diagnose in hours with this AI in like minutes.
Okay, but
Yeah.
why not come with for nurses? I'm not talking
So
about
I no there I know there's like, I mean, I will definitely explore it later tonight. You know what
I
can
think
help.
you should,
You
David.
know.
Like, what?
Yeah. No, I mean, definitely like with the EMR, especially like that being like, you know, a daily tool. Like I feel like you could definitely there's going to be like a big progress in it. It's just a matter of time. You know. I know like, you know, certain places are switching, you know, EMRs back and forth, but
I literally had no idea you like had a degree in informatics.
oh,
Like, that's
informatics.
like, yeah, I feel like you could be running with that. What? Forget going to these like conferences and throwing in IVs. You do that already. Like, focus your energy on something else. Like, you could absolutely what?
Yeah.
Listen, I'm asking for 1%, okay? Or what? Like, but what I'm saying is like you can absolutely do that. Like, literally, I feel like things to make our lives easier. Like you have the experience in like you've gotten a taste to see what nursing is, how things are in different systems in the hospital. I feel like, I don't want to say how hard can it be, because yes, it can be hard
Mm.
essentially, but can it be done? Yeah, like I feel like there's a different million paths that you can go. And if you have that background or whatever, the only reason why I'm even saying this and like I'm trying to put a battery in your back is because as soon as you said informatics, like your tone changed. I don't even know if you even realized that
Oh.
your tone changed. Like you like almost kind of got a little like excited. That's why I'm like, what are you wasting your energy on right now? Like,
No, it's definitely a great field. You know, so much like because EMR we do everything in it. You know, talk to like
yeah,
doctors, patients, information, like collect data. You know, during COVID came out, you know, it was like I think like certain medications we only found if it was effective or not because like all the information we got through like EMR systems. So stuff like that, you know, is definitely like the tool of the future. In terms of like AI, like the only thing is like we're like at the beginning, you know, like the beginning of AI. Like the progress we made from last year to this year is like such a big change. Like I can imagine like the next 5-10 years. So you know, I'm definitely looking forward to it. I definitely want to integrate. You know, I would love to help integrate it and make like our lives easier. But you know,
I honestly think you should. Okay, so welcome to the Nurses Note, where we share our own stories. As nurses, we have to document what we are dealing with our patients and kind of paint a story. And in the Nurses Note, on the nurse aspect, I want us to be able to document our own stories. So, what's your note?
so my note, I would say probably this is like I definitely bring. I feel like I definitely see the bright side, but I will tell you personal like probably the worst interaction I had. So it was this. I want to say this is like 80-plus-year-old female. She basically had, you know, I was trying to be like like I said, I love my patients. So she was like, hey, can I walk with, you know, can you walk me? And I was like, yeah, sure, no problem, you know. So I knew her history. I knew she had like low blood pressure. She was like in the 80s to 90s. But then I had this patient for this is my third day with this patient. So before I walked there, I was like, hey, I know my staff, especially like my NP, she was like, hey, can you check her blood pressure? And I checked her blood pressure, and it was in the 80s. And I was like, oh, okay. I mean, the past couple of days has been like that. And then also, she was given the clear to walk. Like her blood pressure is 80, so that's like the doctor assigned to her was
So
like,
that was her baseline.
yeah, the doctor assigned to her was like, yeah, you can walk her. I was like, oh, okay. So my patient, I was like, maybe we're like 100 feet in, we're walking, this is my probably second time walking with her. So I know her, second time walking with her. I walk with her, and all of a sudden, like she's like going down. I try to catch her, but unfortunately was not quick enough. So she hit the floor. She hit the floor, and it was like in the middle of the nursing station, so everyone saw this. So luckily, help was there. And then I tried. So I tried to like we do the basic protocol, check her blood pressure. I knew it was low, so it was in the same range. But then when we tried to lift her up, she was like screaming, "Oh, my hip, my hip!" And usually that means that it's something's going on with her hip. Basically, we basically brought her back to the bed, and then I had the like NP take a look. She went and assessed the patient, ordered an X-ray. Unfortunately, she broke her hip. So now like the patient is livid, and then I know patient, she's sweet, but listen, end of the day when you hear like, oh, you broke your hip, and guess what? you're staying in the hospital for extra weeks, you know?
Mm-hmm.
So she was very upset. And then I think she called her daughter and told, now I have an angry patient and an angry family member. So that was definitely the bottom of my nursing career.
Mm-hmm.
The fact that is, like there are times, I felt like, hey, I was helping the patient, but then maybe I shouldn't have, extended that hand. Maybe, had PT work with her,
Mm-hmm.
and the only thing is like, I think she was maybe like 1 or 2 days leaving, she was like
She
right
definitely
there
was
out the
getting ready to
door.
leave.
Yep.
Yeah, she was
Leaving,
leaving like the
she,
next day or the
yeah.
yeah.
And I think she was like definitely like downgraded from ICU too. So, she had a long stay. So
Mm.
unfortunately that stay was a little bit longer. So
Yeah.
yeah, I know, like definitely like, like for me, I guess like I took it to heart because like, every time I go in shift, I want to make sure like I do the best for them, like I want my patients to like leave the hospital, like as soon as possible. I know like walking is like one of the best methods for you to get out of the hospital.
Mm-hmm.
You staying in bed all day, I know like is gonna make them more deconditioned, more risk for like injury down the road. So I do promote, like me personally, I do promote like, hey, do like walk. When you're free, walk. You have the energy, walk. If you need help, we'll help you. But it's that one incident, just like like I wanted the best for her, but it bit me in the ass. Yeah.
Yeah, I think we were all surprised. Like when I remember when I was coming back on the shift, and I was just like, "Who fell? Dang, she was just about to leave."
Yeah.
And I remember seeing you were like so crushed. And then like when we found out like she had a hip fracture, I was like, "Yikes!" Like you were definitely crushed. And I honestly, I feel like I feel like it's a real part of nursing. We never go into work thinking like, all right, we're gonna do the worst, like the service for our patients and stuff like that. But sometimes things happen, and we learn from it, whatever. But we're also human as well. Um, and I feel like sometimes, like I feel like people don't really talk about like the real side of nursing. Like things do happen. Like we don't go in trying to harm our patients, but unfortunately, she fell. I know she was just like she did not want to deal with you after, and I'm sure it was the same on your end, just because like you just felt so guilty over it. But I mean, what do you feel like you learned from that?
Well, you're definitely right. I couldn't look at her. I was like, yo, I was like, I
Yeah.
called you. I was like, yo, change my team. But from what I learned is basically, I felt like, hey, like, so what I learned is basically like, and so this got a little bit more escalated because like, now because it's like a hip fracture, it was escalated where I had to like meet with the manager and all that.
Yeah, yeah, yeah.
And then during our interaction, like they questioned me, but never like drilling me, like they were supportive. It's like, hey, just what happened, and like I did tell, like I did the right steps, like, so I know, like I never got penalized for it, so I did the right steps. Hey, I let the provider know, this, like blood pressure was in this range, got the okay from the doctor. So, everything was documented and done per protocol. But for me, it's like, I feel like, hey, I do want to do the best for my patients, but, maybe, let, the professionals take care of it, like, to be honest, if she wanted to walk, maybe, like I should have just, waited for physical therapy to come, walk with her, and I know like physical therapy, every like every specialty has their own, they have they have more knowledge than we do, like we just are like, we we do basically every role, but they have a little bit more expertise. So
Right.
I
We have
felt
like
like
a little bit about, a little
exactly.
bit about everything, but like we're not the expertise in
Yeah,
PT. Like,
nurses, you're supposed to do, like know a little bit of everything basically,
yeah. Right.
But yeah, so definitely felt like, hey, that I definitely overstepped my boundaries on that part, and also like also like, hey, maybe I they say, oh, delegate, maybe I was thinking like, should I delegate that, should I let someone else, so that was like, just like, you know I've been a nurse for like 6 years, like after a while you get into the certain the certain role, maybe it's time to like step back and like, hey, just reassess, like where you stand.
Mm-hmm. I agree with you. There was something that you said that when you said that like you went with the proper channels, like you didn't try to cover things up. I feel like that's very big because I feel like a lot of times like stuff happens in nursing, and if like nobody's around, like you don't say anything, and it could cause more harm to your patient. Or like a lot of times people think like, all right, if I say something, I'm gonna get in trouble for it. I'm gonna get fired. I'm gonna, whatever. When it really, you never know. Like, what if the thing that you're doing for your patient, like, yes, what happened, it was a mistake or whatever, but now because you didn't say something, now there's an adverse reaction to what you did, and we could have intervened, and stuff like that. So I love that you did that. I'm glad that they didn't penalize you or whatever, and I don't think that that was something that you should have been penalized for anyways. Just it was just the way that things happened. And also, yes, it did happen, but I also feel like it was almost good that it happened in the sense that like we all could learn from it, like to prevent stuff like that from happening in the future.
I mean, like certain people, like you mentioned right now, I was thinking back, like we could have discharged this lady, and then she could have gone home and fell, they're like, oh, 90, like 80 is good for her, but, luckily, and I don't know if it's lucky or not, but it happened in the hospital where we were like able to like accommodate her. Imagine she was home alone,
right?
If she fell, maybe, that choice of like, hey, 80 was good for her baseline, maybe was inappropriate, maybe it should have been, maybe 90, so yeah, unfortunately it happened in the hospital, but luckily, we were there to help her, so that's like one, good thing that came out of her, out of that. So
if you could share a tip with either your former self or with something that you've seen over your career, like what would you want other nurses to know?
So I'll tell you personally, like my first gig, I was very unhappy with nursing. I actually hated nursing so much, and I was like, what did I get myself into? I was like, oh my, like it was basically more of the hospital system I was at. I hated nursing. I was like, oh my gosh, like, why did I do this? I can't, wait to get out. Maybe I should look into another career. There were times I was like contemplating. I was like, time to switch it up, maybe, or do like something else. But luckily, yeah.
Because Lord knows it seems like you love a switch up now.
Yeah, I was like, no. But I'm so grateful. But I want to say, like, if you are stuck in like don't think of like your unit or your job or career as a life sentence. Like if it doesn't work out for you, try something else. Because where I first started and now it's like apples and oranges. Like I love going to work. Like I go to work stress-free and I leave stress-free. I couldn't say that when I was first started. Like I would dread my days going into work, and then I would dread leaving, like, because I don't know what's going to happen. It's like, definitely my best, if I could give advice, is like keep exploring. There's so many things you can do with nursing, like myself, I tried informatics, procedurals, inpatient, outpatient, if you want to start your own business, if you want to start your own podcast, yeah, social media. So it's definitely like a great field, and keep exploring. There's a lot to do there.
Okay. I love that.
Yeah.
Thanks for coming
no
by.
problem.
Definitely listen, whenever you grow your business or you do whatever you want to do, you're more than welcome to come back and share.
Looking forward to it.
If you want to share the coins, if you want to bless a student and be like, let me pay your tuition because I got to like that, But yeah, thanks for coming by. Appreciate it. Listen.